Namaskar. Welcome to this session on harnessing the power of breath. Breath works and you. So, before I start, uh, two things I want you to remember. Every first and third Saturday of the month, in the evening, 4 to 4:30, we are focusing on lifestyle disorders. So, next Saturday, in the evening, we are going to have very important discussion on gut health, gut brain axis, fogging of brain and your gut, how they are interrelated to each other. And the speaker is going to be a very well-known gastroenterologist, Dr. Ashok. So, my humble request, share this with your, we are going to release the poster also soon, so share this with your family, friends, so that we can have maximum benefit and maximum participation. And before I start, second thing is any questions, queries. We have focused a lot on diaphragmatic breathing. What diaphragmatic breathing is, what are the good signs of a diaphragmatic breathing? Nasal, noiseless, no jerks, no pauses, and then ratio of 1:2. And then we learned how it can be done in three postures: upright position and while lying down. Lying down is lying down on the back supine, lying down on the tummy prone. This is the basis diaphragmatic breathing. There are various names. It is also known as belly breathing or abdominal. Again, I am telling you, abdominal breathing doesn't mean that air goes into the stomach. A lot of people think this. No, air cannot go beyond the lungs. As simple as that. So, but when we are doing abdominal breathing, we are making sure the movement of diaphragm is there. Chest movement or rib cage movement you have to minimize and you have to maximize the diaphragmatic movement. For a good breath to be effective, physiologically efficient, your breath should be contributed at least 75% by the movement of diaphragm. Remember, another, there are three, four benefits of diaphragm. One, it gives a very good massage to the heart. That is a beautiful massage. When the movement of the diaphragm is there, the massage movement. Second, it gives a good massage to the abdominal organs. Number three, which is very, very important. Remember, there is a nerve passing through the diaphragm, and that nerve is the mainstay of parasympathetic nervous system, which is basically relaxing nervous system. So if you know how to activate that nerve which passes through the diaphragm, it is known as vagus nerve. You all must have heard about this. It's a trending nerve as far as social media is concerned. Vagus nerve, hacking of vagus nerve. How? Just by movement of the diaphragm. So if you are a chest breather, you are unable to get the benefits of parasympathetic nervous system. If you are in abdominal breathing, if you are doing abdominal breathing, if you are using your diaphragm, then you are making sure that you remain stress free, you are relaxed. So by doing diaphragmatic breathing, you are able to activate the vagus nerve. Number four, when because of the movement of the diaphragm, there is a sort of vacuum created in the abdominal cavity, which sucks the toxins from all over the body, from the lower extremities, upper extremities, chest, head. So if the vacuum is created, more toxins are effectively taken in and they are thrown out when we exhale. And second thing, which along with this, if you remember, you have to lengthen the exhalation. Normally 80-90% of us have got shorter exhalation as compared to inhalation. So if we can lengthen exhalation, lengthening of exhalation means you are able to throw out more toxins. As I told you in the last session, you can, the lungs, by using the lungs, 70% of toxins are being thrown. Rest of the 30%, for rest of the 30% toxins, we are using kidneys and the skin. Skin is sweating, kidneys, urine, excretory system. So they just contribute 30% of the toxins which are thrown out. Lungs contribute 70%. So remember the importance of breathing exercise, breathing. So these were the things which we had focused on. I hope you all remember and you have been practicing, you have been getting the benefits also. So any queries, any questions, if you have got, maybe we can take after we have done today's session. Today, I plan to focus on a very important breathing exercise or breathing technique or part of the pranayama. As I told you, breathworks is nothing but collection of ancient yogic techniques which have got, which we have been able to decode in a scientific. So this one exercise is going to help you in three ways. First one, it will make you calm and quiet. Yes, if you practice this type of breathing, which I'm going to talk about, you will feel calmness within 5 minutes. Second, because of that calmness plus because of the action on various organs, it will bring your blood pressure down by 5 to 10 immediately. 5 to 10 millimeters, immediately it will come down. If it is 150, you measure this, do this exercise for 10 minutes, you will find that from 150, 90, it has come down to 140, 80, 85. It will become less by 5 to 10. And third is, it activates the part of the nerve, part of the lung, which usually doesn't participate in the breathing. Normally, what happens? The lower two-thirds of the lung is participating in our when we are doing breathing, inhalation and exhalation. This upper one-third is in normal breathing, it is not active. But if you do this type of breathing, then the upper one-third also becomes actively involved in the breathing process. So what happens? If you have got a pulse oximeter, put a pulse oximeter in one of the fingers, check your oxygen saturation, and do this exercise for 5 minutes. Immediately, you will see the saturation. It's already there. You see, if it was baseline was 94, 93, 94, will go up to 98 plus. You can touch 100 also. So just by doing this, how it is happening? You are activating the upper one-third, which is usually inactive in normal breathing. Okay. So remember these three things. Lot of benefit with this pranayama or breathing technique, but these are three, four main physiological and mental. Another interesting thing which I want to tell you about this is just by doing this breathing, if you are a meditator, if you are on a spiritual journey, you will find a lot of people by practicing this type of breathing, they achieve one pointed mind dharana and then they go into meditation. This is a beautiful way of deepening your spiritual journey. I hope you all are ready for this type of breathing. For this, you have to do a first simple exercise. What is this simple exercise? See, this is our mouth. Okay. This is the base of the mouth, inside the mouth. And this is the roof of it. Okay. What you have to do, you have to bring what is there on the base of the mouth? Your tongue. Take it out, then roll it upwards so that the tip of the tongue touches the roof of the mouth. Okay. See, I will show you. My tongue is rolled. When I'm speaking, I have to straighten the tongue. But otherwise, I can easily do. While you have rolled it, with practice, you will find that there should be no change in the muscle facial expression. See, Take it out. Good. So this is one, people call it tongue lock also. But this is a beautiful mudra, which is known as Nabho mudra. Nabho. Nabho. Nabho mudra. This has got lot of benefits. One session is two less. If I start enumerating the benefits. So maybe next session also we will talk in detail about this mudra only and this prana. In yoga science, this pranayama is known as Ujjayi pranayama. Ujjayi. Must have heard about this. Ujjayi, Ujjayi. Ujjayi means victory over oneself. That is Ujjayi. Okay. So you how you get victory over oneself? Your mind becomes wide, one pointed, clarity of mind. Nothing bothers you. At the same time, your actions are perfect. Whatever action is required in that particular moment, because of the clarity of it. Second thing, when you roll the tongue like this, what will you do? After rolling the tongue, if you can take the tip back, see, the roof of the mouth has got two parts. The front half is hard, that is known as hard palate, and the backside one is the inner half is softer. It is known as soft palate. The roof is known as palate in medical science or English, and then the front part is hard palate, back part is soft. So what you have to do, you have to try to make sure that your tip touches the hard palate. That's all. This is good enough. But if you want to increase the benefits, then you have to take it backwards. You have to roll so that the floor of the tongue, listen carefully, floor of the tongue comes in touch with the hard palate. The tip will go further towards the soft. Hard palate, soft palate, rolling of the tongue. So this is the complete how you should be doing, the complete way of doing the Namo. Okay? Again, I'm showing you. Take out your tongue and roll it. Two things which are required in every technique, every yogic technique. What are those things? Inner smile and awareness, सजगता बहुत जरूरी है. अवेयरनेस हर चीज में, जैसे आपका टंग टंग टिप टच करेगा ऊपर पैलेट को, feel the touch, feel how it is gliding backwards towards the softer palate. That's a must. So what will happen as soon as you start doing this? You can try this also. Just focus inside your mouth. That's all. Just keep focusing, keep focusing. We talk about breathe, how to add breathing to this. Mudra will talk about that. Just keep focusing on this. Keep focusing on it. Slowly you will find that more saliva is being secreted. There is a collection of saliva inside the mouth because of the rolling back. The salivation is there. That is the first sign that you are doing it correctly. That's the first sign that you are doing it correctly. Okay? Keep applying it till you find that there is some tiredness in the tongue. You are able to apply it for 3, 4, 5 minutes. Excellent. But initially, what happened? What is a tongue? Tongue is a muscular structure. It's a very powerful muscular structure. So it's an unaccustomed exercise for the muscle, tongue muscle. So what happens? You may have some soreness in the tongue initially for a day, 2, 3, but don't worry, keep on practicing. It's a type of weight training for that muscle. So, like when I'm doing weightlifting, working on my biceps and triceps, what happens? First day, I'm able to do it very enthusiastic. When I get up in the morning next day, what happens? There is soreness in the muscle because of the muscle tear or because of the unaccustomed exercise done by the muscles, biceps or stretching of the muscle. So this soreness is perfectly normal, nothing to be worried about. If you keep practicing with the weight, slowly the soreness on the biceps goes away. Similarly, if you keep practicing with this Namo Mudra, your soreness in the tongue will go away after a week. So don't worry if there is some soreness. You need not take any medicine for the soreness. Nothing to worry about. So as soon as you roll this, what happens? You feel increased salivation in the mouth. That's a good sign. That means you are doing it. That helps in lubrication of the mouth, lubrication of the various nadis which are present inside the mouth. That's another advantage. But we will not talk about. We have to focus because you are all scientific people. Focus on the science behind this technique. So as soon as I roll this tongue, what happens? There are two main vessels, carotid vessels, right carotid, left carotid. They supply blood to the brain. You know, the way they pump, they give blood to the brain. That comes to know that whether there is increase in blood pressure or if the heart heart pumping is with pressure, blood pressure is high. The heart pumping is normal, then blood pressure is normal. If the heart pumping is less, then the blood pressure is low. So when the blood pressure is high, what happens? The heart is pumping more forcefully. So blood inside the carotid vessels, these are big vessels in the neck, this goes with the pressure. So what happens as soon as you roll the tongue, there are carotid sinuses inside the this carotid vessel. So they are able to make out blood pressure is high. They give the signal to the brain and the heart to decrease the pumping pressure. So what happens? They give the suggestion to the brain gives the suggestion to the heart that you are pumping with too much pressure, decrease the pressure. Pressure comes down. And immediately within 5 minutes, you will see the blood pressure will stop. So this Nava Mudra, what is happening? For Mudra is activating the carotid sinuses which are present in the carotids. So this you have to understand. It's a beautiful technique of bringing your blood pressure down. And if you have got any of the lung disorders, it will help in activating the upper part of the chest, which is usually inactive now normally. Okay? Ready? Now, once you have rolled this, you gently close your eyes. Imagine there is a hole in this neck region, and you are breathing in and breathing out through that. Of course, air is going to go through the nose only, but you just have to visualize there is a hole in this. This is known as sternal notch. कंठकू इसको बोलते हैं ये sternal notch है. You can see there is a depression here just above the sternum. This is the chest bone sternum. इसके ऊपर यहाँ पे एक notch है. This is known as sternal notch. यहाँ पे imagine करिए there is a hole and you are breathing in and breathing out to that. That's all. Deep inhalation, complete exhalation with Navamudra. And if you do this, then I can vouch your blood pressure will immediately come down. I am not saying you stop taking your medicines. Keep checking, keep checking, keep checking. Before decreasing or stopping the medicine, you have to contact your physician or colleague, whosoever is prescribed with you. But it comes down to a normal. I have seen a lot of people, especially in the beginning, who have got mild increase in blood pressure. They respond beautifully to this. They need not be put on any medication for. But for that, you have to keep checking it on a regular basis. If the blood pressure is high, still high, then of course you have to take the medicine. So my again humble request for decreasing the dose, don't think that immediately this is going to, it is going to be effective, but don't decrease it yourself. Talk to your physician, talk to your consultant before decreasing the dose. Okay? So rolling of the tongue, Navamudra, and synchronize this with the breath. Breath means imagine as if you are breathing through the hole in the neck. So let's practice for 2 minutes. Let's see how it happens. Okay? Yes. Again, sitting, remember, maintain the curvature. See, your hip joints have to be at a higher level as compared to the mid joint. Remember, this is the basis of all the posture. Whether you're doing breath work, whether you're doing pranayam, whether you are sitting for meditation, whether you are sitting on computers, you have got sedentary lifestyle, then make sure that your position remains like this. Hip at a higher level as compared. So that the curvature, four curvatures are well taken. Unfortunately, most of us don't follow this dictum, and the result we have got cervical spondylitis, we have got lower backache. They are basically the cause is poor posture. That is the most important. Okay? So once you have stabilized your posture, take your tongue out. You all can practice with me. You know? Take it out, hold it. Once you stabilize the position of the tongue, then just close the eyes. Imagine there is a hole in this sternal notch. I hope you can hear this sound, as if you are standing near an ocean. See, you know what happens? There is glottic muscles. There are muscles around the vocal cord. They get contracted. So what happens? This Namo Mudra also helps in contracting the glottic muscles. As a result, you are able to activate the upper part of the lungs also. So because of the sound which is produced like this, see, this is also known as oceanic, oceanic. There are various other ways which I am going to touch upon how to learn those techniques, those various ways. You can practice any of them. One is Navo Mudra, I told. Navo Mudra is visual. Second is without Navo Mudra also, if you find it difficult, you've got some problem with the tongue, you are unable to do this. This is the best technique which I have told. This is the best one which you can do. If you still find difficult to roll your tongue, because about 10% of people are unable to roll the tongue properly. So nothing to worry. Then just close your eyes, visualize there is a hole here and you are breathing in and breathing through this hole. That will also give you the benefits of Ujjayi Pranayama. That will also decrease your blood pressure. That will also activate the carotid sinuses. That will also activate the upper part of the situation will go. So if you are suffering from any of the lung ailment, especially COPD, chronic obstructive pulmonary disorder, this is a beautiful exercise. This activates whole of the lung. COPD, or you have got ILD, interstitial lung disease. Of course, changes are not going to go back. Their anatomical changes are there to go, there to stay. The exchanges will be hampered in ILD, interstitial lung disease. But this will increase the level of oxygenation. So you will be feeling more comfortable during your day-to-day activity. So you can do without rolling the tongue also. Just visualize this. The glottic muscle contraction. What is the glottic muscle? Where exactly it is located? See, there are various ways you can learn which muscle you have to contract. You simply say how. As if there is a mirror lying and you are trying to make it foggy. This is the same muscles which are getting contracted. This is while exhaling. How much you are exhaling? Slowly what happens? Internalize it. Then add this to your inhalation also. आपको अगर समझ आ गया तो बहुत अच्छा है, इनमें से कोई प्रैक्टिस है, नहीं समझ आया तो मेरे पास आइए कंसल्टेशन के लिए। आई एम सिटिंग एट वेनु, VIILM, वेनु इंस्टीट्यूट ऑफ इंटीग्रेटिव एंड लाइफस्टाइल मेडिसिन। आप आइए, वी विल टीच यू how it is to be done very easily. You have to learn this. You have got no choice. You have to learn this. You have to be healthy. You have to activate whole of your lung. You have to make your blood pressure down. Or whenever you are anxious, then anxiety, the blood pressure goes up. A lot of times, even if you are not an hypertensive, who doesn't have high blood pressure, and anxiety is bound to be there. Stress is bound to be there. There's so many things happening around us. कोई बॉम्ब छोड़ रहा है ईरान पे, कोई इंडिया में प्रॉब्लम कर रहा है, कोई हमारा पड़ोसी कर रहा है, कोई हमारे घर वाले कर रहे हैं प्रॉब्लम। सारी प्रॉब्लम है, स्ट्रेस है, तो यू कैन वर्क ऑन योर सेल्फ एटलीस्ट। तो what is the beauty of this breathing? This breathing exercise can be done in any posture. You can done one while lying down. You can do while lying down on the prone, while lying on the tummy, while lying on the back, sitting, standing, walking. This is the only pranayam which can be done in any posture. That's the beauty. In all other pranayams, there are, you have to follow certain rules. No, you have to sit like this one. This can be done anywhere, walking, inverted poses, even inversion, even in headstands, even in shoulder circles. This can be done. That's the beauty. So please practice this. I've suggested few techniques. One is you can do this. Second, loud whispering. We should whisper loudly. You are using glottic muscles. You are contracting the glottic muscles. So understand which muscle you have to contract and which carotid sinuses you have to activate. And even if you do, this is the only pranayam which all of us should be doing. All of us should be doing. Either breathing technique or pranayam, whatever you want to call it. This is a must. You have got no choice in your life. Want to remain healthy? That's it. Only if you want to do only one pranayam, this is the one which you can understand. So any queries, any questions before we go on to chair yoga? Remember, lengthen your exhalation, tongue rolling, the posture, proper posture, five good qualities of your breath. Remember, incorporate them into your lifestyle. Don't wait for half an hour in the morning or 15 minutes in the evening. No, incorporate them into lifestyle. But you are sitting in the car, being driven by someone else. You are sitting in the metro. Do Jai Pranayam, do diaphragmatic breathing, lengthen your exhalation. Don't worry about what others are going to listen. You have to focus on yourself. You have to remain healthy. Yes, sir. Yes, madam. Please. Any questions, any queries? You are most welcome. Otherwise, we will go on to chair yoga. Yes. Okay, namaskar. You will certainly share with friends. Thank you. These simple techniques also will, you have become expert. You are becoming expert because you have been practicing this. Diaphragmatic breathing is the basis of all the pranayama. If you are doing Nadi Shodhan for n number of years and not your foundation is not diaphragmatic breathing, you are not going to get it. You are making it noisy, this, then you are not going to get the all the benefits. Do not say that it is not beneficial, it is beneficial, but maximize the benefits. This is the beautiful treasure which has been given to us by the nature, divinity. Any question? Then we will proceed over to the chair. Okay, thank you. Chair yoga also simple things which you remember last time we focused on the warm up. How to warm up. Every yoga session, every exercises, whether it's a gym exercises, whether it's jogging, running, brisk walking, initial phase has to be given to the warm-up session. Then do the session which you want to focus on. And then cooling off. This is a must. Similarly, in chair yoga also, there is a warm-up session. Then you focus on a few exercises so that they cover each and every muscle of the body and then go in for the cooling. Okay, so last time we had talked about the warm-up. Remember, simple, sitting jog. A armless chair without wheels, that's a must. Okay. Simple job, simple job. Smile is a must with awareness. Feel your feet going up, going down. Spot jogging, spot jogging, spot jogging, spot jogging, spot. One. Second is twisting of the torso. Simple, simple. You don't have to stay at one. Uh, uh, Basically, you are acting, warming up your body. Third is you hold at the back, otherwise I would have taken it further. Warming up, shoulders and arms, shoulders and arms. Then the shoulder shucks, shoulder shuck, shoulder shuck, shoulder shuck, shoulders. You don't have to stay. Keep it. Pulses. We call them pulses. Pulse. So this is almost wound up almost all the muscles of the body. You're not focused specifically on it, but this is wound up all the muscles. So this is a warm up. This is simple. Simple things which you can do. Warm up. Fingers. Today I am going to focus on the foot. How to this is very important. A lot of people are suffering from plantar fasciitis. We are going to touch on few exercises which will help in plantar fasciitis. One, plantar fasciitis usually presents with the pain in the heel or lot of pain in the shoe. Commonest cause are the way our posture, again, posture and the way we are using our footwear, defective foot. It's the commonest. So see, you have to focus on three. And what I'm going to do. Three. Toes, knees, toes, knees, toes, toes. You can also do along with me. So 10 times toes, 10 times home. So if you are doing a sedentary job, you are working computer, you can do this. They're simple exercises, not only for, of course, it's a boon for the senior citizens like me, but then for people, younger generation, those who they find they don't have any time, you know, yes. Then come on to the toes. Raise your heels as much as you can. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now come on to the heels. I'm raising the toes. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then circle, circle. Clockwise 10 times, anti-clockwise 10 times, anti-clockwise 10 times, 10 times. See. Similarly with the other, clockwise, clockwise. Then 10 times. 10 as big, circle should be as big as possible, as big as possible. They are good for ankle, they are good for your toe, they are good for your heel, they are good for plantar fascia. Basically, plantar fascia is it has got not a good blood supply. So it's very difficult to treat plantar fascia. Even painkillers sometimes do not help because there is no blood supply. So what you have to exercise is the only answer. So another thing is another exercise. See, These are very important. Open your toes, close, open, close, open, close, open, close, open, close, open, close. See, 10 times, at least 10 times. Change. Open, close, open, close, open, close, close, open, close, open, close, open, close, open, close. Now see, open and keep it like this. Just see, I have tightened, I have stretched all the muscles of the foot. See, open your toes. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Again, open, keep it open. Stretch your toes and contact all the muscles of the foot. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay, then inversion and eversion. Invert in this, like this, 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 this. Inversion, eversion. Inversion, eversion. Inversion, eversion. See, inversion, eversion. Inversion, eversion. Inversion, eversion. Eversion, see. Inversion, eversion. Outwards and inwards. Outwards and inwards. Outwards and inwards. See, it's simple. One very important is what you can do is alternately you can put your foot. This is a beautiful naturopathic way. Hot immersion, cold immersion. Alternatively. Hot immersion for some time, then come on to the neutral immersion, then come on to the cold one. So if you do it alternately, what happens? It activates the blood supply to various ones. And if possible, do the immersion up to the knee, if possible. If not possible, then at least your ankle should be covered. Fit up to the knee. If you can do this, do exercise inside the water, they are helpful. They are very helpful. And another specifically one is for, just visualize that there is a, like, if there is a cloth. I am just putting this cloth with my toes towards myself. Just pulling, pulling. This. It's a beautiful, this is one of the best exercises taking care of the seat. I am pulling the cloth which is lying on the floor with my toe towards, I am trying to pull it. See. This is beautiful. It's an exercise basically. So this is the exercise which we did also. Open, close, open, close, open, close. It's an excellent way of taking care of plant nutrition. If you do all these exercises, this will really take care of the plant nutrition. Apart from other benefits also, which we are going to discuss about diabetes, folius pump, because of this. So, friends, incorporate this lifestyle. It's a simple one. You can do this anytime. It's, as far as food is concerned, you can do it anytime. Of course, you should be avoiding immediately after meals, but otherwise before meals, anytime you can do. And you will find that your circulation improves. You are going to take care of this. The plantar fascia part. This is very difficult to treat. Only solution is exercise. Only solution is exercise. There is, because of the plantar fascia, a lot of people have got, you know, this heel becomes very painful. There is a many a time the spur they start forming, extra bone they start forming. So this is the only solution. Exercise is the must. Again, second one which I told you, one is you have to pull the cloth. Second is immersion. That's very good. If you come to the naturopathy center, they have got all these facilities. They make sure that you are able to have your cold immersion, hot immersion, neutral immersion also. And you will find immediately you get the benefit in one or two sittings only. You start getting it. Plus, if you add exercises to this, then you are going to take care of the purification. So, any questions, any queries about this quantification part? Otherwise, we will close this session. Any questions, you are most welcome. Again, I am reminding you, we have got a YouTube channel, VIILM VCS. Please subscribe to that YouTube channel. Share with your friends. We are going to upload not only these sessions, online sessions which we are having, otherwise also we plan to have a lot of shorts, lot of reels, lot of bigger videos also, so that you are able to take charge of your lifestyle. Remember the YouTube channel. What is the name? VIILM VCS. Okay. So thank you very much. Always grateful for joining the session and hope to see you next Saturday. We have got on gut health, gut brain axis. Very important topic. Dr. Ashwini said, I remember. So see you next Saturday between 4 and 4:45 in the evening. Thank you very much. Namaskar.